Hello, welcome to this latest installment of People in Science Live by Cargill Publishers. I'm your host today, Will Mountford, and it is my absolute joy to be joined by Dr. Alain Labrique from the WHO, the Director of Digital Health and Innovation there. Hello.
Hi, Will. Good to see you.
Good to be seen. Now, we have a lot ahead of us in terms of digitization, artificial health, transforming healthcare. So I'm going to get out of the way as quick as I can and ask you to just tell everyone listening a bit about yourself, your current role, and what's, some of the steps that have led you to where you are now.
Fantastic. So, hi, everyone. It's lovely to be here today. Thanks so much for hosting me and taking on this interesting topic. I think there's a lot to talk about. I'm Alain Labrique. I'm the Director of Digital Health at the World Health Organization here in what is today a sunny Geneva in Switzerland. And I recently joined WHO about 2 years ago. I used to be a professor of international health at the Department of International Health at Johns Hopkins Bloomberg School of Public Health, where I was the founding director for a center called the Global M Health Initiative. So I think more importantly, I'm also a proud dad to a teenager going to school here in Switzerland and a college senior in the US. And I like to see myself as a Belgo-Bangladeshi Indian. So my dad was Belgian, my mom is Indian, and I was born and raised in the beautiful country of Bangladesh. That's my identity, as it were. Currently, I'm in the Department of Digital Health and Innovation that works to support 194 member states of the World Health Organization. And what we do is we identify and integrate appropriate technologies to strengthen health and wellness. We work across 6 regions of the globe, together with our regional offices in Europe, in Southeast Asia, in Western Pacific, in Africa, in the Eastern Mediterranean, and across the Americas. And the work that we do is quite diverse because we work to help countries, first of all, establish and develop what we call national digital health strategies, together with costed roadmaps that help them get from where they are now to the future they want to be, using technologies appropriately to help improve the health and wellness journeys of people all around the world. We develop norms and standards, which looks at how these technologies should be implemented. And we look at the evidence. We look at the literature, the science around which interventions using these technologies are actually impactful. And all of that is really based on robust data, information, evidence that's collected through rigorous science. In emerging areas like artificial intelligence, what we've done is we've brought together the world's experts, and this is how organizations like WHO work. We have a lot of expertise in-house, but we bring together really the experts from academia, from industry, and what we ask them to do is help us to formulate that evidence-based guidance on everything from the ethical implementation of artificial intelligence to the regulatory needs, that how do we ensure responsible use of AI tools. And we also work to map the maturity of countries in their foundational readiness to implement digital health at scale. And through this convening of thought leaders, we help to guide countries not just to adopt the best of breed technologies and appropriate technologies that help improve the health of people, but also to keep an eye on the frontier. What's coming down the road? What's the next big thing that we as WHO and as health systems around the world need to be ready for? Mm-hmm. From AI to virtual humans to synthetic biology and beyond. And so the last thing I'll mention is also within the remit of our department is looking at how to ensure that people, no matter where they live on the planet, can have access to reliable, timely, trustworthy, and accurate information. And so we've worked with not just the scientific experts from whom that information is coming, but also with social media channels and big tech industry to make sure that information can be delivered to the places where people are online, but also help recruit their support to fight mis and disinformation and to make sure we're promoting that reliable, trustworthy information that WHO generates to be at their fingertips. Yeah, so that's sort of a high level perspective, and maybe a little later I'll talk about some of the really exciting high profile projects that I'm really thrilled about.
On those coming up, but to just address the people part of our People and Science Live name, is there anything that, you as a human being, you said you're a dad, you're a citizen of the world by all means, is there anything that you are enjoying out in the world at the moment? Any good books, podcasts, TV? What about Alain, the person, before Dr. Labrique, the international expert?
So Alan, the person, loves to do many things. I from woodworking to repairing broken appliances to reading science fiction. So I just finished reading the three body problem that seems to be on everyone's science fiction hot list. I'm a fervent addict to NPR, the U.S. National Public Radio. And as we've moved around the world, I've tuned in from any device that I could connect to an internet connection to download that stream. I enjoy reading Wired, Science magazine, and basically keeping up with the global digital health literature. So I read a lot, I watch a lot, I'm pretty active on social media, and I try to stay abreast of what are people talking about, which isn't always in the published literature. So it's important to keep fingers in all the different pots that discuss these topics.
Now, you mentioned a few of the geographic stops on the way to the WHO. If we could spend just a bit more time exploring how those have shaped your view on life and the person that you are, from Belgium, Bangladesh, Johns Hopkins, all the way to the WHO. What along the way do you think has been formative or an important part of your journey, so to speak?
Yeah, no, it's a great question. I mean, we really are the product of the path that we've traveled. And I actually began my training as a molecular biologist, and I was looking at the world through a microscope and watching how yeast cells go through cell division and tracking the small errors in that process that could cause this whole system to stop and correct themselves. And after spending several years gazing into microscopes and culturing yeast, I realized that I really needed to be working at a much more macroscopic level. And that led me to the field of infectious disease epidemiology. So that very quickly led me back to the country where I was born and really looking at what were the pressing issues of rural Bangladesh, and by and large, it was maternal and neonatal mortality. This was in the mid to late 1990s, and really realizing that despite all of the great innovations that were happening around the globe, we still had an untenable number of young moms and pregnant women that were succumbing to basically preventable deaths. And so, that led me to commit to doing a lot of field work in these rural populations across South Asia, Sub-Saharan Africa. And while I was working in the villages of northern Bangladesh, I began to notice, as many people in my cohort around the globe did as well, how the introduction of mobile phones were a game changer. They were a game changer in how people communicated with each other. They were a game changer in the opportunity to reach people with health messaging. And they were a game changer in terms of shifting that trajectory of towards mortality that I was so frustrated in seeing happening in young moms and newborn babies all around me. And so, in those early years, we began to see how a simple phone call could make a difference between life and death, where these technologies, as they began to be introduced slowly with low availability, where you might have one village being able to afford a single mobile phone that was shared across the entire village, or small-scale entrepreneurs bicycling through these villages with a phone in their pockets, making phone calls available for a small fee. And very rapidly, we saw this expansion, not just in Bangladesh, but across South Asia, across Sub-Saharan Africa and Latin America. In really the global South, these technologies leapfrogged the entire brick and mortar and copper cable infrastructure that the European and North American countries had to go through. And so after 10 years of living and working in Bangladesh, I returned with my new family now to work at Johns, where I started this academic center, really continue to advance the research and scholarship, and also to ask, how do we engage governments in this process? What are countries asking for? What's the state of evidence, and how do we accelerate that process? Right? I was seeing it happening organically, but was there a way we could codify these interventions, these innovations into health systems? And so together with colleagues at WHO, where I was just working with them at the time, we began to explore, is there a way where we can formalize this space, what was then called M-Health or mobile health? Can we come up with a shared language around what we are doing with these technologies? Can we integrate with other fields that have been existing for decades, with like telemedicine and health informatics? So how do we take what was happening around the world organically and formalize it? And so I was really privileged to co-chair the process of WHO developing the first ever digital health guidelines, which meant an organization like WHO was taking digital health very, very seriously. And so we've continued to expand research collaborations and build capacity, and really begin to build a roadmap to move from a state of global e-chaos with healthy experimentation towards more systematic transformation. So in my heart, I'm still an epidemiologist, which means I like to approach problem solving in a very structured way. But since then, I've become a global health innovator, an evangelist for change, and really excited to be part of a phenomenal team here at Johns Hopkins at WHO, where we have people from all around the world coming together to explore how to support countries in what we call digital health transformation, and that's really been the culmination of my experience so far.
Ask which came first, the fixing appliances and reading sci-fi and the massive technological leaps in mobile health and technology development as a health application, or do the two kind of go hand in hand?
Oh, I've been opening, to my mother's chagrin, I've been opening up home appliances since I could hold a screwdriver. So I think it just speaks to an innate sense of curiosity that is so helpful in any field, really, not just global health, but where you are willing to ask why, to challenge the way things are, and really to push the boundaries. I think when I started working in this space of digital health, my department chair, he pulled me aside and he said, well, listen, it's okay that you're doing this for as a sort of a side gig, but keep one foot firmly planted in science, and make sure you keep working on the infectious diseases and the micronutrients that really are going to be the bread and butter of your career. And I took his advice, and I kept plugging along in that field, but in parallel, I kept pursuing this what was once considered the lunatic fringe, but now there's an entire department of digital health at the World Health Organization, and not just here, but the World Bank has prioritized this. 120 countries have articulated a national digital health strategy. So it really has gone from being the crazy idea, the mental birth, the thought experiment of the lunatic fringe, if you would, to now being the way things should be done in in countries, whether or not you're in a low resource or high resource setting. People want health systems that are person-centered, that are convenient to them. And what's more convenient than this technology that we all carry with us in our pockets, making sure that we can access information, professional advice, and even schedule health care at our convenience and not at the convenience of a system.
We've had a question come in asking, in which third world country or group of countries the WHO made so far the most progress in health digitalization, and by what means?
So I think we don't refer to them as first, second, third world anymore. I think these are countries that are developing or in the course of developing and progressing, I would say, quite admirably in many parts of the globe in making inroads towards strengthening their health systems. And I think singling out any country is a difficult task. One of the things the WHO has done is take on, as I mentioned, the maturity measurement of countries, just to look at where a country is today based on certain foundational criteria and what might be the services that it can offer people based on that level of ecosystem maturity. Is there reliable electricity? Is there reliable connectivity? What bandwidth do you have in that particular setting? And based on that, something as straightforward as a text message or a phone call may be the breakthrough application that makes sense for where that country is in that process. But there are countries that have really grabbed the proverbial bull by the horns and said, no, we've seen during the pandemic that having a robust capacity to develop and implement digital health solutions can make the difference between life and death. And so, take the example of Indonesia. They have a national digital transformation office. Take the example of Rwanda, who almost a decade ago invested in digital infrastructure, not just for health, but for all sectors. And those investments are paying off in droves today. Take the example of Kenya, that just last year launched a national Digital Health Act, a law, putting into place this vision and the financing necessary to transform that vision into reality. So I think across the globe, from North and South America all the way through to Europe and Asia, different innovations are being applied just to address the problems that are priorities for those countries. And we're seeing innovations like telemedicine really take off with the concept of virtual healthcare as a first point of contact for patients in countries like Saudi Arabia, where they are trying to really push the boundaries of saying, when and where a patient needs help, can we provide them access within, I think the estimation was under 10 seconds, can we put them in touch with a clinician who can help guide them to the next step in their care journey. So I think globally, depending on what the priority challenges are, there are solutions that can be appropriately applied to address the bottlenecks and challenges that have been faced. But that, I will say that these technologies aren't magic bullets or magic wands, if you would. They have to be taken in context. We have to recognize that introducing digital health is not going to address health workforce shortages. They're not going to address inadequate funding for supplies and for monitoring and for supervision, right? And they're not going to replace the political will to invest in robust health systems. So yes, we can certainly do some phenomenal, exciting things with these technologies, but we also have to take a systems approach to solving some of these problems.
Mm-hmm. Well, to echo the comments that you made earlier of digital health moving from a kind of a fringe idea to being front and center now. That could also be a comparison drawn to AI that has gone from, the future, the distant future, to in your phone right now, today. That's something that anyone else can get a hold of. So I was wondering if you had any thoughts on how, those two journeys either mirror each other, and then some of the future. We can get into this with specific questions, but in broad terms, what is AI and, machine learning, the whole family of development, doing for digital health and medicine?
Yeah, no, it's really a great question because it's hard to find a newspaper or a blog post that doesn't have an AI component to it these days, because it really has, I will say, over the last 24 months, taken the world by literal storm. I think the first point I always like to make is to say that digital health and AI are tools, right? And AI, much like its digital counterpart, has been around for quite some time. Machine learning and big data analysis and artificial intelligence. And so these algorithms that can be encoded into technology that learn from data in different ways, right? So you have machine learning and now large language models or large multimodal models that help us to perform automated tasks or to accelerate some of the more rote or human intensive tasks that sometimes are themselves the bottlenecks to achieving our health system goals. And so, recognizing that these new generations of AI can be really transformative. They have a tremendous potential to help us address some of these bottlenecks. And I'll say WHO, as many as 3 or 4 years ago, actually published guidance, which is really formal instructions and support to governments to say that the use of artificial intelligence to help accelerate the reading of medical images, especially in the case of TB diagnosis, would be something that it should be recommended in contextually appropriate settings, because we had found that this was a major obstacle to getting people in countries where the TB burden was extremely high into timely, rapid care, so that we can stop transmission and we can ensure a better outcome for that individual. So you imagine X-ray technician working in a rural community where he or she may be the only one serving a population of millions. So they at any one moment may have hundreds of X-rays to scan through to identify individuals who are suspected of having TB and individuals who are more or less clear or do not have suspicious lesions. And what AI enables us to do is use that individual's time more effectively. So by triaging in a much more rapid way, AI is phenomenal. These machine learning models are phenomenal at detecting anomalies from patterns. And so by triaging the 13 or 14 out of a pack of several hundred that may need that dedicated human attention, they can make sure that person's making the best use of their time, and then accelerating those people's referral into care. So I think all that goes with saying that these systems need a couple of things. We need to have the enabling environment around them, which are the first and foremost the human capacity, right? We need people who have the skills to understand how these technologies should be used, how to interact with them, how to know when they're doing what they should be doing, and how to know when they're malfunctioning. I think these are skills that can be trained and taught over time. But we also need to have in place around those people governance structures. We need to have regulatory structures. Who's responsible if something goes wrong? How do we ensure accountability for these systems? And I think those are things that are really critical. Whether you're talking about digital health or AI, those need to be in place. I think the other thing we've also realized is that these kinds of solutions for the last 20 years have largely been introduced as piecemeal solutions to big problems, right? So you'll see digital technology introduced here or an AI model introduced there for a very specific vertical problem. But there hasn't been this systematic architecture-based approach until the last 5 or 6 years, where we started to see countries really taking a step back. I think especially driven by what we all experienced during the pandemic, where we recognized there has to be a systemic architectural approach, where we have to define what are the plans of the building, how we're going to put all this together, what are the standards and the linguistic interoperability that systems have to use, so that your data will, as you go into one clinic for a particular condition, and then you move and later, a few months later, go to another clinic, that data can actually travel with you as part of your continuous health record. And for that to happen, we need, these sort of ecosystems of standards which allow these systems to interoperate with each other. And so, I think the big shift that we've seen is embracing of these systems, yes, as mainstream, but also recognizing that they don't succeed in a vacuum. We have to make sure that we're also investing in an environment where they can thrive and they can be person-centered.
A question come in that I'll come to in just a second, because I think the next question I've got on my mind might touch on some similar topics. That TB is a familiar, still resilient, still changing, still lethal disease, but one that is fairly well characterized and understood. When it comes to emerging pathogens, things like a pandemic, for example, what place does digitization and AI take in improving that kind of response?
And I mean, so you ask a great question, because that's one of the areas that really unlocked a whole, I will say, next level of confidence in digital health and AI to some extent, but really mainstream digital health systems. I say first and foremost, getting information to people. During epidemics and pandemics, scientists, we're learning information in real time. Sometimes the pathogens are new and emergent. We don't understand fully how they're transmitted, what the risk factors are, how we prevent that transmission. And so there's a need to be in continuous communication with the public. And so leveraging these technologies to get information to the public was one of the seminal ways in which technology was used. Being able to disseminate across clinical networks the latest sequences of viruses or pathogens that are of interest, so that we can have scientific collaboration in real time, is another important area. But supply chain management, making sure that when you have limited or shortages of drugs or vaccines, or even therapeutic supplies, to be able to manage and distribute those supplies equitably in a population, and making sure that people know where to go if they have certain conditions, is another way that these channels were actively used. But now, as we look at the future, I think we see a lot of effort being put into the use of AI and digital technologies to strengthen surveillance. And when I say surveillance, I mean epidemiologic surveillance, not Big Brother surveillance. So using these technologies for epidemiologic surveillance, which means keeping and integrating multiple information streams to be able to start to see aberrant patterns early in that process. So as I mentioned earlier with the X-ray, one of the things that machine learning and AI is really good at is detecting aberrations from normal, right? When it has studied terabytes or petabytes of information, it knows that this specific pattern is something that is a baseline, and then it can begin to detect deviations from that baseline. And so as machine learning models or AI models look at these multiple streams of information and begin to integrate aberrations, either in the number of individuals with a certain symptom or the emergence of the excessive use of a particular drug in a specific geography, that can begin to set up red flags that need to be investigated to see, is there a signal here? Is there something worth investigating that we can cut off a potential pandemic or a potential epidemic earlier in that process? And then lastly, the really great example of technology that was used in emergency is telemedicine. Because as we all experienced for many, many months, when lockdowns were in place or reduced mobility was in place, pregnant women could not go into the clinic for antenatal checkups. If you had a pediatric emergency, you had to go through tremendous number of loops to get an appointment with a pediatrician. So what many countries did was look at their laws that were sometimes inadvertently holding back clinicians from using telemedicine as an option. And we saw around the world people begin to experience health at their convenience. They began to see that they could use their handheld technologies to connect with clinicians, with providers, and get advice or get prescriptions digitally, facilitating that care. And so I think one of the things that the recent pandemic created was a sense of confidence that these technologies not only can work, but they are game changers when it comes to delivery of care.
That confidence is key to Paul Nunes D's question that can we be sure that a AI-based triage does not leave anyone behind who would be needing attention, what the safety net procedures are in place for that kind of occasion, and confidence, trust that you are getting no false positives and no false negatives as well seems to be key, not just for using ChatGPT to generate an essay question or an answer if you're in school, but if the stakes are your life or death, I imagine there's a lot to be done to build that kind of trust, confidence, and ultimately investment in whether that answer is there.
Absolutely. I mean, I think, Paul, you asked a really good question, or Victoria, or Paul, one of you have asked a really good question, and one which we could spend an entire day discussing. WHO has put out now multiple pieces of technical guidance on the ethics, on the governance, on the regulatory aspects of AI for health, echoing other bodies around the world that, including the UN Secretary General's high-level advisory body on AI. There is now a European health AI law that's in place. And so what all of these policies and regulatory frameworks do is really enshrine the safety nets or the safeguards to make sure that first and foremost, these technologies do no harm. Right? What we don't want to do is implement a technology that then ends up causing more problems than you had to begin with. And so there are thresholds of evidence that exist for technologies writ large, but for diagnostic tests, for decision support tools, to identify the degree to which these systems perform. How sensitive and specific are they in terms of correctly identifying a condition or correctly identifying the absence of a condition when one is not there. And I think, what we have to always insist on is that there's a human in the loop. And that right now is de rigueur in health, one of the cardinal pillars of responsible artificial intelligence, making sure that a human being is involved in the process of especially diagnostic or clinical decision making. I think we also are setting a very strong bar to make sure that there is constant surveillance, much like you would do for a drug released in the market. You have post-market surveillance, and so many regulatory agencies have issued guidance where algorithms, especially ones that are learning and that are modified over time, actually also have that feedback loop to make sure that their performance continues to be monitored after that release. But I think I could go on for a while, but by and large, it really does come back to the country capacity and the human capacity for regulatory oversight and enforcement. And that's really critical to ensure that, especially right now in some parts of the globe where we're in a bit of a nascent regulatory space, and there may be an opportunity for ill-intentioned or well-intentioned companies to come in and promote a particular product as a solution for a health system challenge without having the necessary checks and balances in place. And what we want to ensure is that these promises are not just accompanied by evidence, but there is a safety net to ensure that the technology operates as intended. I'll just take the moment because I think the question is really appropriate. There are 6 key principles for ethical and responsible AI, and I think I'll just enumerate them because I think it's worth thinking about as a framework. The first is, as I mentioned, protecting autonomy. And what does that mean? It means that, as I mentioned, the human in the loop, ensuring that there's human control over these systems and the decisions that are ultimately made in that patient pathway. They have to promote human well-being, safety, and public interest. And what that means is, prioritizing safety and making sure that, as you mentioned, these safety net procedures are in place. Some even have suggested the idea of a circuit breaker. When there's a detection of an aberration or an anomaly, that these systems can be stopped in that process. Ensuring transparency, as well as explainability, which means that the AI results can be explained, that there's a logical framework that we can understand how the AI got to the conclusion that it is providing to the clinician or care provider. Making sure that responsibility is clear, so that's number 4. Making sure that there is a clear role and responsibility for the different players in the ecosystem, including the developers of the technology, the users of the technology, and the enforcers of the regulatory frameworks. Equity, right? Ensuring inclusiveness and equity. And this has been one of the earliest criticisms of this space, is that often we find that these large models have been trained on data sets that are not representative of the population in which they're being used. And so it's really important that the representativeness of the data is carefully studied before the models are developed, and making sure that the way in which the models function, there's not a persistent bias due to that training data set that perpetuates either the biases that we as humans have brought with us culturally or historically, and that those biases get perpetuated, whether those are racial biases, gender biases, etc. That the AI actually can be perhaps more fair than this issue. And that we promote artificial intelligence solutions that are responsive and sustainable. And so that means really thinking about the long-term support of these models and making sure that the environmental considerations of these models. We've had in recent weeks a lot of chatter around the potential disproportionate carbon footprint of large language models compared to, say, traditional computing approaches, and how we balance out what that means for is the juice worth the squeeze, or is the outcome worth the cost? And so those are things to sort of keep in mind as we go through this.
Yes, to kind of plan this in time for anyone who's listening back to it later, it is early September in 2024, and this is a field in development. These tools are being refined, the edge is being honed. And what you mentioned there about that things are changing in terms of the equity and the outcomes is echoed in a comment by Stephen Wani asking that, the investment question of what you put into what you get out is becoming more and more frequent, that they want to see success stories, that things have been practical and affordable, especially in low and middle income countries. Is that something that you see as a pardon me, is that something that you see as a particular direction for future research and development that is on your radar? And are there any other avenues for the future that is kind of front of your mind?
Yeah, absolutely. A great question from another leader of this space who could be in this very seat answering these questions almost as well as I could, because Stephen really has been a thought leader in this space, and it's been a real pleasure to work with him. But the investment question is certainly one that is top of mind. It's a topic that we just finished discussing at the most recent G20 meeting in Brazil. The question of how do we measure and how do we make the case for value for money? And I think what we're seeing is there are multiple questions, right? There's the question of how do we understand the cost effectiveness of these technologies, and what do they bring us in return on either improved health or reduced cost of operating a health system, as well as the costs of sustaining these technologies over time. I mean, there's certainly many savings to be had by shifting from paper and analog-based systems that have inherent inefficiencies and risks built into them. But it's not to say that a digital environment is not without cost or recurring costs as well. So we have to think about if we have devices in the field, those devices may have to be replaced on a certain clip every 3 to 4 years, perhaps. And I think those come with costs. So I think what we are seeing, though, is, as I mentioned earlier, there is a demand that's coming from people, from the users of health systems, that they are looking for more person-centeredness in how they seek and receive care, how they seek information and have access to that information. One of the most used technologies for health information is, many people would argue, Google search bar, right? So people are going to Dr. Google or Dr. Bing for their health questions. And so, it's the convenience of having that source of information, trustworthy or perhaps less so, that I think people are always going to seek. So what do we need to have? What do we need to do? We need to ensure that as health professionals, that we're meeting people where they are. We're meeting people who are looking for these services and this information at a place where they're going to find that information. Yeah, that's a really good question.
The space between people, patients, healthcare professionals, data and technology, and peer review, making sure that there is that sense checking, that there is that human eye, that quality check to avoid false negatives or false positives, is a space where you could say that health publishers, such as Kaga, happen to sit. And you see that health science publishing, in terms of data quality, transparency, trust, is that something that is a useful place for that industry to be? And is there any challenges coming down the road?
Yeah, I mean, just before I joined WHO, I was the editor-in-chief of the Oxford Open Digital Health Journal. And so believe you me, I know the pain and challenges of being in this space that you are. But absolutely, right? We all have a responsibility in this space for advancing the science. And I think the task of um, ensuring that good science is always at the forefront of the publishing industry is going to be increasingly challenging, right? We've seen just in the media and in a number of analyses the sort of um, disproportional use of artificial intelligence assistance in developing manuscripts or writing papers or even analyzing data is increasing, right? And I think everyone's busy. We're always looking for ways to accelerate the work that we have on our plates. But I think, as I mentioned earlier, these technologies have to be used responsibly, and so um, one of the tools that we don't have in our arsenal right now is are reliable ways to detect artificially generated content. I mean, there's a slew of tools out there. Depending on the model you use, depending on the tool you use, depending on a lot of other factors, the certainty with which you can detect real and fake content or real human generated or artificially generated content is becoming is the ability of ours to differentiate those two is quite challenged. So I would say that I have a call for improvements in that sector in the near future would be fantastic. But I think as journals, we do have to ensure that we are making sure that research priorities are communicated to the public, that gaps in the literature are prioritized, that we don't continue to publish good articles that don't really advance the science, that we really have to ensure that the seminal questions of the day are addressed. And that we continue to pursue the trajectory of openness to make sure that science is accessible by as many people as possible, so that it's not only open to scrutiny, but it's also available so that nobody is reinventing wheels.
Pretty. It's going to be eventually worth asking the question, and if this is a question you've heard before and have maybe gotten a little bit tired of, then I apologize, but I will ask, is AI, digitization of health, a huge investment that goes with that in developing the consent, the consensus, the expertise, coming at the cost of not paying attention to other health goals or other initiatives that maybe could have immediate impact for same or different amounts of money?
That's an interesting question, and it's probably one that President Kennedy had to answer when he made the call for the going to the moon in the late 1960s, right?
Remember the quote of, "We do these things not because they are easy, but because they are hard."
Yeah, yeah, and I think we have to keep in mind that these innovations are not hopefully an either or formula, that we're not investing in these instead of something else. That the ultimate objective is, we invest in a digital health infrastructure, we invest in artificial intelligence tools because we find ourselves faced with persistent bottlenecks that have challenged the global health community now for years, if not decades. And so when we look at, some of the solutions that we know work, oral rehydration solution, kangaroo mother care, essential early life vaccinations that can save lives, prevent illness, and reduce morbidity or severity of disease, we still struggle to just get those interventions to those people who need them the most. So when we look at the investment in these technologies is to serve as an amplifier, to serve as an accelerator of those interventions. When we look at, for example, the use of GIS and micro planning in looking at the programmatic distribution of bed nets, right? That's an equity use, a use of a technology to ensure equity, to look at communities in a particular country and see whether there are areas that have been left behind. When you're doing indoor residual spraying for malaria and you look at a map and you see, big blank spots because community health workers are out there doing their best, but there may be pockets where coverage just hasn't reached. And so, these are where technology acts as an adjuvant, right? An adjuvant is an ingredient you add into a vaccine to accelerate its impact. And then similarly, we see digital health as an adjuvant to the effectiveness of these interventions.
That time is pressing on, so let's
But
take the
just
last few minutes.
I just will say one last thing on that point. That's not to say that we should barrel forward willy-nilly, spend a blank check on all of these. At the end of the day, why are we spending our time and energy on helping countries develop good governance and clear national digital health strategies? Because when you have that roadmap and plan in place, that allows for a responsible, costed approach to this digital transformation that addresses the priorities that you've articulated as a country, and it creates resistance to external pressures, whether those are from companies or donors coming to the table with niche priorities that don't fit within a national strategy, right? And so that's really why we have really doubled down on focusing on countries, focusing on country autonomy and capacity, and making sure that local production, that local leadership can be resilient in the face of all of these pressures to spend money maybe a little bit irresponsibly.
Well, with the last few minutes that we have, I'd like to cast an eye to the future. And of course, things are changing right now, let alone by tomorrow, a few years down the line. So I will ask for not any, predictions exactly, but what would you say would be your ideal future in terms of how things pan out with digital health and AI solutions, either for yourself as a professional, as a a person working alongside all of these systems as they grow and change, or maybe on a global scale? What would be the ideal future in the next 5, 10-ish years?
So I think the two words that come to mind are trust and embeddedness, among many, many others. One is trust. And to achieve trust, we have to have, I think the term is radical transparency, right? Systems need to be transparent, open, available for scrutiny, clearly documented, and well understood. And I think that radical transparency is key to engendering trust. A lot of people have talked about, well, why don't we just allow the ecosystem to proliferate? Let people try different things. Let these ideas really flourish, and then in a couple years' time, we'll figure out what works and what doesn't work. Maybe, but that's also a way to lose trust, because it takes just one catastrophic failure to then reset the journey up that mountain back to the bottom. And so you might have gotten to base camp 1 or 2, but now you're at the very bottom in the Kathmandu Valley of Everest. If you're not careful and cautious in your implementation. I think there is especially in health, there has to be a degree of oversight, a degree of cautious optimism as we move forward with this. So that was one, and the second was embeddedness. And embeddedness means achieving a state where the technology is imperceptible, where it becomes part of how you work, it becomes part of how you optimize your workflow, how you do with the limited time more better, and where it's not a noticeable distraction to your work. Right now, one of the biggest obstacles to the use of the electronic health record is the fact that it is something clinicians stop their engagement with a patient, they turn to an update, or they spend time after the fact transcribing their notes or charts into a different system. Some of the colleagues I've met with in academia and industry are working on AI systems that can be just omnipresent and listening to the conversation between the patient and the clinician and transcribing the salient components of that interaction into a structured set of notes that then accelerates the clinician's review of that case later on. Now, of course, there are many questions with that process, but certainly that's the kind of thing that is embedded within the workflow, that is not disruptive, that doesn't take an additional set of requirements. But I think anyone who has tried to prognosticate the future sets themselves up for failure. And so, I think we have to remain curious. We have to continue to challenge status quo. And when things are not good enough, we have to be courageous to stand up and say, this is unacceptable, or this is not good enough. We can do better. And it's that interdisciplinarity that has kept me so excited about this space now. I've been here for almost 2 decades. The interaction between informaticians, technologists, ethicists, human computer design experts, philosophers. It's just fantastic. Artists. This space is just so rich with different perspectives and different ways of problem solving that I don't think I can say I've had a dull day since I've gotten here. So I'm looking forward to hopefully many more of these.
It's neatly to time. So I'll say thank you to everyone who has joined us through LinkedIn. Thank you to all of the questions and comments we've received. And most of all, thank you, Dr. Labrique. For everyone listening at home who would like to join us for the next session, that will be in October. But until next time, that is all from Karga Publishers, People in Science Live. I've been Will Mountford. Thank you and goodbye.
Bye-bye.